The world's health systems are entering a new era of unpredictability. Climate change, once treated as a slow-moving environmental issue, is now a daily medical challenge. As heat waves, floods, and wildfires grow more frequent and intense, clinics are becoming the first line of defense in a crisis that no longer follows the seasons. Preparing clinics for climate surprises is no longer optional, it is a matter of survival. Extreme heat events can knock out power, overwhelm emergency rooms, and endanger both patients and staff. When these shocks arrive, the best-equipped clinics are not necessarily the largest or most advanced, but the ones that have built resilience into every part of their operation, from cooling systems and medication storage to mental health support and community outreach. The biggest threat often comes quietly: heat itself. Many clinics, especially in developing regions, are not designed to handle prolonged high temperatures. Air conditioning is limited or unreliable, and when power grids fail, refrigerators storing vaccines and insulin can quickly overheat. Without functioning cooling systems, critical medicines lose potency, and even routine treatments become risky. Patients with chronic conditions, heart disease, respiratory illness, or diabetes are the first to suffer. Staff, too, become vulnerable as dehydration and fatigue impair judgment during long shifts. When every room feels like an oven, even basic care becomes dangerous. The reality is that most clinics were built for a cooler, more predictable world, not one where heat waves can last weeks and reach record-breaking levels. The first step toward readiness is acknowledging that climate-driven emergencies are now part of healthcare's normal operating conditions. Clinics must anticipate electricity outages and water shortages as regular occurrences. Backup generators are crucial, but they are only a temporary fix. Sustainable energy sources such as solar panels with battery storage are increasingly vital. These systems ensure that essential equipment, oxygen concentrators, neonatal incubators, vaccine refrigerators, keep running even during blackouts. In heat emergencies, shaded outdoor spaces or temporary cooling tents can serve as triage zones for heatstroke patients, relieving pressure on indoor facilities that may become dangerously hot. Yet, for many regions, the challenge is not just infrastructure but funding and planning. Climate adaptation must be treated as core healthcare investment, not as an environmental add-on. Another overlooked risk lies in air quality. Heat waves often coincide with stagnant air and rising pollution levels. Wildfires add to the crisis, releasing fine particles that exacerbate asthma, COPD, and cardiovascular conditions. Clinics should stockpile N95 masks and establish clean air zones, especially for children, the elderly, and pregnant women. Portable air purifiers, even in small rooms, can reduce hospital admissions when outdoor air becomes toxic. It may seem like a minor intervention, but in times of crisis, clean air can save more lives than advanced technology. Staff training must also evolve. Recognizing the signs of heat exhaustion, dehydration, and smoke inhalation should be as standard as knowing how to treat a fever. Mental health care, too, must be built into emergency planning. Climate disasters often trigger waves of trauma, anxiety, and disorientation that last long after physical injuries have healed. After major heat waves or storms, clinics report spikes in depression, panic attacks, and substance use. For this reason, basic psychological first aid should become part of every clinic's response protocol. Counseling corners, peer support groups, and even simple rest areas can help people recover a sense of safety. The staff themselves are not immune. Witnessing suffering under worsening environmental stress can lead to burnout and compassion fatigue. Protecting healthcare workers' mental well-being is essential for maintaining the strength of the system as a whole. Clinics must also rethink their supply chains. Climate disruptions can cut off transportation routes for days or weeks, leaving essential medications stranded. Facilities should keep larger buffer stocks of critical drugs, antibiotics, antihypertensives, rehydration solutions, and maintain local supplier networks whenever possible. Cold chain logistics should include temperature monitors and contingency plans for heat exposure. These details, though technical, can mean the difference between a functioning clinic and a humanitarian emergency. A single storm, flood, or power outage can now trigger cascading failures if preparedness is not built into every step of care delivery. In coastal and low-lying areas, clinics face dual threats from rising seas and saltwater intrusion. Flooded treatment rooms can spread infection, while saline-contaminated water supplies make sterilization difficult. Buildings should be elevated where possible, with water-resistant materials and sealed electrical systems. Safe drinking water must be secured through filtration units or stored reserves. Each of these measures adds cost, but the cost of inaction, loss of care capacity, disease outbreaks, and avoidable deaths is far greater. The experience of hospitals in regions hit by recent hurricanes and cyclones has shown that clinics without physical resilience plans become liabilities rather than lifelines. As climate surprises become more common, early warning systems can bridge the gap between chaos and coordination. Clinics should be linked with meteorological services and local governments to receive alerts on upcoming heat waves or storms. This allows them to pre-cool wards, check generator fuel, mobilize staff, and alert at-risk patients, especially those relying on home oxygen, dialysis, or temperature-sensitive medicines. Public messaging through community radio or social media can guide residents on hydration, cooling, and recognizing danger signs before emergency rooms fill up. Health preparedness is not only about equipment, it is about communication and trust. The warning signs are clear. Climate change is stretching the limits of healthcare infrastructure worldwide. Yet in every region, there are examples of clinics adapting creatively, installing solar-powered cooling, developing community heat shelters, planting trees for shade, and integrating environmental data into patient care. These small shifts represent a new model of medicine, climate-aware healthcare that treats both the body and the world around it as interconnected systems. The danger is that adaptation is lagging behind the speed of change. Each new heat wave, each flood, each wildfire brings heavier losses, often to the same vulnerable populations: children, the elderly, outdoor workers, the poor. The longer we wait to strengthen clinics, the more the burden shifts from prevention to emergency rescue. Preparing clinics for climate surprises is not just about readiness. It is about preserving human dignity in a future where disasters will no longer feel exceptional. If health systems fail to evolve fast enough, the next climate shock will not simply test our resilience, it will expose how unprepared we still are for the world we have created.